I'm Dr. Sabina Dosani. I'm a consultant child and adolescent psychiatrist, and by that I mean that I trained first as a medical doctor. I did that 20 years ago at St Bartholomew's Hospital in London, and there I was trained very rigorously to look at physical causes of disease, including illnesses that can cause emotional and behavioural disturbance. After that, while I was a junior doctor, I specialised in psychiatry and illnesses of the mind, how to recognise them and how to treat them, and then spent 3 years training further to be a child psychiatrist. And that training I did at the Maudsley Hospital, which is Europe's leading international research centre for mental health. And I was very lucky to train there because the skills and expertise I obtained there were from world experts, from people who are real leaders in their field. One of the reasons that people often consult someone who's a psychiatrist rather than another type of mental health professional is that the sorts of disturbances in behaviour and emotion or disruptions in academic performance that parents come to me because they're worried about how their children are, there can often be a physical cause. For instance, a teenager who's depressed might have a disruption in their thyroid hormone. I can ask the right questions to help them get to the bottom of that. A little boy with disturbed behaviour, it could be because he's got low blood sugar levels, he might have a brain tumour, it could be epilepsy. There are a lot of reasons why the behaviour might be disturbed. I'm also trained in talking treatments. Often people think if they're coming to a psychiatrist they'll leave with a prescription, but I help people using techniques from family and couple therapy. I use a way of helping called brief solution focused therapy and cognitive behaviour therapy, and in essence that means I can very often help with difficulties over the phone by giving people very practical things that they can start doing straight away, rather than talking at length about difficulties that they've been in the past, but give them things they can run with in the here and now. Families say they like me because I'm not a fusty man in a suit, and they find me approachable, easy to talk to. I tend to have a good rapport and relationship with the teenagers and the younger adults I work with as well. Another thing that families and the lawyers I work with appreciate is that I'm good at translating quite complicated medical information into plain English, and that's led to me doing quite a lot of writing for national magazines and newspapers. And I've also produced a series of books with the Infinite Ideas Company that help families do very practical things to improve the mental health of their children and their own mental health. I can help with a whole range of emotional and behavioural disturbances, from very small children who are 2 and 3 years old who are perhaps not speaking yet or having difficulties with prolonged bedwetting, children who are having emotional outbursts or big temper tantrums. In older children, I can help if there are concerns about hyperactivity, poor concentration, children who are perhaps very lively in the classroom or who find it hard to sit down and do homework. In teenagers, I can help if there are fears and worries that seem out of proportion to the sorts of fears and worries that all teenagers have that seem to perhaps get in the way of friendships or home life. I'm often asked to help when people form new relationships and are bringing children from previous relationships into a new family. And I can help with ideas on how to successfully blend a family, and also work with women who've chosen to have children on their own before perhaps finding their life partner. Very often people are looking for a second opinion. They might have been to their GP or seen someone like an educational psychologist who's given them an idea about what might be going on. And with some families that resonates and they can run with it, but there are many families too who think that doesn't really fit. I'd like to run this by someone who's got expertise in these different areas, who can talk me through what the other options might be, whether we should be following this treatment plan, or if there might be another problem going on that's been missed. Because of my ability to translate quite complicated medical information and unpick the dynamics, if you like, of family life, I'm often asked to write reports to help the family courts and also the civil courts where there are questions about a young person's mental health or parenting abilities. I've written a series of self-help books for a range of different conditions. There's one called Calm Your Hyperactive Child, another one Defeat Depression, one Re-energize Your Relationship, and another called Banish the Bullies. And in each of those books there are 52 different ideas and practical things that families can put into place straight away. So there's really one new idea for every week of the year, and at the end of each chapter there are some common questions that I've been asked in clinic and my answers and suggestions for people to put into practice straight away. One of the things that really stuck with me when I was at medical school was seeing adults who often had very serious mental illnesses and learning that mental illness usually starts in childhood, somewhere between the ages of 8 and 21. These things start. And I find it very exciting that during my time training as a doctor, we've been able to learn how to intervene early and stop very small problems growing into large and big and difficult things that are harder to treat later on. So that's why I chose to work with children. One of the joys of working with teenagers is that things change very quickly all the time, and families can help shape and mould how their behaviour is going to be. So I find it very rewarding. I enjoy working with whole families rather than with people in isolation. And I really like being able to give people ideas and very practical things that they can do, try out and run with straight away, and then hear how their family life has changed, not just the life of the person who's been suffering.